listening to Practice on Purpose, where physicians can explore how to set up their career on purpose from the very beginning to stay connected to their purpose for their entire career. I'm Dr. Nicole Eull, a health psychologist with decades of experience in healthcare, from the front lines of a level 1 trauma center to the leadership in one of the largest healthcare systems in the country. I'm passionate about physician well-being and creating mentally healthy workplaces. If you want to thoughtfully establish a career that aligns with your values and passions and ensure a long and rewarding life as a physician, then you've come to the right place. Today, we're talking about the rewards and challenges of working in global health and public health. Our guests are Dr. Cindy Haq, a retired family physician who continues to engage in public health initiatives in California and who has a career full of transformational work to share. We also welcome Kirk Scirto, a family physician in New York State who's worked and served in multiple countries and is the author of Doing Global Health Work, Approaches That Really Make a Difference. Welcome, Cindy and Kirk.
Hello, and thank you for having us.
So excited.
Nice to be here. Thank you.
Great to see both of you. So I'm going to start off by having you guys give your own introduction and kind of a little bit of a starter, so you can describe your path to working in the global health arena, and how did you get started, and when in your career did you get started? So we'll start with Cindy.
Well, again, thank you, Nicole. And I feel like I got born into a global health role. My father came from India, my mother from Indiana, and I grew up partly in Pakistan, where I saw a great deal of people living in poverty. That troubled me as a child, and I wondered, why wasn't anyone doing anything about it, and what could I do? So I went to medical school with a very deep motivation to work in areas where the needs were greatest. Mm-hmm. At the time when I trained, there were few women in medicine, and there weren't very many others who were doing international work. But there was an article in the Journal of the American Medical Association that provided a listing of physician opportunities abroad. I went through that edition, and I found anyone that would accept a new family doctor with her husband and 3 children. Wow. I should back up to say that when I got married, before I got married, my husband and I talked about my interests, and I made sure that he would be supportive, and he absolutely was. And so that was the start of my journey in global health.
Great. And I think as the listener stays with us, you'll hear that there's a lot of adventures ahead in this story. What about you, Kirk? How did you get started?
Oh, sure. So I was a sophomore in college, and there was an opportunity to join a medical service trip, what I've later called a suitcase medicine, going out to poor communities in rural Jamaica. So I joined this trip, and essentially it's stuffing your suitcases with meds and medical supplies and going from village to village. While setting up makeshift clinics. It's very adventurous and hard work, and it really inspired me tremendously. It's the reason why I decided to go into a career in global health. But after a very busy day at the clinic, there was a family medicine resident who sat around this bonfire and said, geez, this is more for us than it is for the people here. Mm-hmm. How did we really contribute to their health in a long-term sense? And these questions went way over my head at the time, but later in college, I volunteered in rural communities in Mexico, and I started asking the important questions. Oh boy, why are we not working with Mexican providers? After all, they've got a far better command of the language and the culture. They know where to refer people. They can do the follow-up. They can set the community priorities. So I became very cynical about suitcase medicine, but I still held on to that dream. I have to follow a career in global health. So very much at that point, I started, taking medical anthropology classes, public health classes. And I very much decided to, really get into the field of medicine and the field of public health, and to do this in a much better way. So starting medical school, I created a small nonprofit in Uganda. And the aim was to have the community pick what our projects were going to be. And not surprisingly, they asked us to address very basic needs of public health programs. And that's exactly what we did. We did HIV education and worked on clean water projects as they wanted us to. But I still had not learned the main lesson in global health that, we can't be the ones, creating these programs and designing how they're going to be. It needs to be the community itself. So all these were the big things that drew me into global health and kept me involved in the field.
I know that what you were saying resonated with me is when I have some mentors in my life as a volunteer and serving others. And he used to always say that when you volunteer, it's really that you have something to learn, not that you're going to teach something to those who are maybe you see as less fortunate or marginalized, is that you're there to learn as a volunteer. So thank you for sharing that and your vulnerability of the growth of your journey there. Both of you, I'd love to hear do you think was the biggest learning moment for you on that journey?
Well, I'll start with my initial match was towards the end of my family medicine residency when I volunteered to go to Uganda, like Kirk, and was selected to be the medical director of a rural health center. At the time, this was the end of a brutal civil war. Most of the doctors in Uganda had either been killed or left. And so there was an extreme shortage of physicians. And I went with my husband and then 3 children. When we arrived, I was surprised to be greeted by the village, who was so thrilled to welcome us because they hadn't had a doctor in 10 years because of the war. And this health center was serving a region of about 500,000 people over a dispersed rural area. It was rather daunting because I hadn't really practiced tropical medicine, which was the main challenge. And my primary role was to train village health workers to reduce child mortality. That was the focus of our project. The administrator of the health center sat me down on the first day I was there, and he said, "I know you're a doctor. You're trained to see patients. We have tremendous patient care needs, but you could see patients here 24 hours a day, 7 days a week till you die, but you won't make much difference because our needs are so enormous. We need you to teach."
Wow.
And if every patient you see, you're teaching one of our staff, you will leave something very important behind. I took that lesson to heart, and really that was the beginning of my career in global health and also academic medicine.
So interesting that you really need to shift your mindset, right? Like you're there to help create the next generation of providers, right? What about you, Kirk?
I feel like that's very, very, very true. And we have this knee-jerk reaction. We're trained to solve problems. We're trained to see patients. We're used to seeing patients. And so folks tend to apply the same approach when they go abroad. But the evidence shows that approach is how we're most likely to do harm to patients and economic harm to communities, and lowering their self-confidence to be able to care for themselves. So I completely agree. I mentioned my 2 biggest early lessons in global health. The third biggest one was spending the summer in a village in El Salvador as a medical student. And I came in and saw this, highly empowered community that knew very well, did just what it wanted, created its own community-based health programs. They're running incredible things on HIV training, fighting a Canadian mining company that was contaminating their water. Also, having a health and human rights organization and a journal and also a radio station. So they, very much, they're working on so many fronts. And it dawned on me that this is really the goal in global health, to have a community, that is absolutely impassioned and has identified what it's working on. And it's not actually asking for any outsiders to come in and save the day. It's very content, running it on itself. But of course, they were happy to set up this long-term partnership, and we played a very much a backseat role, and had them identify if we're going to help in some small way. How can we actually do that? And I think not every community is in that same place, but I think it really is the goal in global health work, to work ourselves out of a job, actually.
So it sounds like both of you are saying that really listening is one of the biggest skills and needs assessment that a person who is dedicated to global health can carry with them, is listening to the actual needs rather than coming in with our ideas of how things should be fixed or changed, right? So Kirk, can you walk us through it sounds like you've already mentioned a few countries. You really got around as a young professional. Can you tell us the different countries that you've worked and served in and what you were doing there?
Sure. The next place I lived in a town in Puerto Rico for 2 years, and did primary care out there, but also there was an American oil refinery that's set up right in the middle of town, and people were choking on the fumes, and there was a protest movement to get them out of town. And I supported their efforts by doing a study and showing they had higher levels of respiratory disease and cancer there. The next part of my journey was joining a global health residency. And it was really a tremendous partnership between the Lenca indigenous people in the mountains of Honduras. It was very much public health focused. There were so many clean water and sanitation programs helping them to build their own preferred model of latrines and slow sand filters, and also improve cook stoves to channel the wood burning smoke out of homes. Scholarship programs so kids could go to high school for the first time out there, and microfinance to develop more income to put toward health and education. Also, we did a lot of training of health workers out there. So this was a very inspiring partnership. And my next 3 trips were over to Sierra Leone, and very much doing focus groups, asking the folks what they wanted to work on. And water and sanitation, again, was top of the list. So they very much decided to create these clean water committees run by women, to enforce water rules and, keep their water safe and do a number of projects out there. So that was a very inspirational experience. I went back to Uganda. I did 4 other trips to Honduras as a resident and an attending. And then in Burma, very much did these focus groups once again. And again, folks actually wanted to work on water and other projects. And we assisted efforts to do disaster relief among internally displaced people. Their government was bombing their own people out there. So the next stage in the journey was spending 2 years in Botswana and in Tanzania, working on health system strengthening, and again, health worker training in the areas of HIV, TB, and malnutrition. I've also done other disaster relief work in Haiti after the 2010 earthquake, and in 2021 after the smaller earthquake, and also in the island nation of Dominica after Hurricane Maria came through. In those places, people very much wanted me to see patients. So I shifted from public health work to medical work. And I think it was very appropriate because, their hospitals were destroyed and they needed some help getting through a rough patch, as opposed to areas of chronic poverty that, they're running the show. They've always been running the show of care, and we shouldn't be trying to take that over. We'll only do more harm than good.
Great. And what about you, Cindy? I think you'll find that in some places your paths were crossing or near misses there.
That's right. Well, after my first stint of working in Uganda, I came back and was at Dartmouth Medical School, where I started networking with the International Rescue Committee and other not-for-profit organizations that were working in the developing world, as we called it at that time, low-income countries. And I was able to get a time of working with Afghan refugees in northern Pakistan, which led to eventually a Fulbright to work at the Aga Khan University in Karachi to help establish the first family medicine training program there. We grew up, maybe Kirk and I, kind of in the same era of when the the World Health Organization had declared we were going to have health for all by the year 2000. And that was our rallying cry. And we believed we could do it, get healthcare to everyone in the world. And so following my work in Pakistan, working on family medicine and child survival, I was invited as a consultant to the World Health Organization in Geneva, Switzerland, to work with an international consortium about how to build up the capacity of primary health care worldwide and what was the role of family doctors. While I was there on leave of absence from Wisconsin, I was contacted by our dean to see if I might lead some global health work there at Wisconsin, and we established the Center for Global Health, an interdisciplinary center combining nursing, veterinary medicine, pharmacy, and really working across the campus to develop training programs at the undergraduate, postgraduate level, and partnerships in about a dozen countries around the world, working on research, curriculum development, and different projects that we don't have time to go into today. But really, the opportunity, and I think about, as I look back on my career, opening doors of possibility, that each step that I took, each assignment opened up possibilities to do more the next time around. And I'm hearing that from Kirk too. One thing leads to another. None of this was planned out at the beginning. Yes.
And when you go into a new project, you come in with all the expertise that you gained in the last project, and your some things you've tried out that don't work, or maybe they do work in this new setting. But I'm sure that you got better and better at figuring out more quickly what was needed and how you could be of help, and who to bring in to help as well. And Cindy, you have a special relationship with Ethiopia. Can you tell us about your work in education there?
So as I was leading the Center for Global Health at the University of Wisconsin, I had a visitor one day, Dr. Gurma Tefera, native Ethiopian, but a very accomplished vascular surgeon. He knocked on my door and said, "Why isn't the University of Wisconsin working in Ethiopia?" And I said, "Well, I don't know. I don't know where to start." And he said, "Well, I'll help you get going." And basically, that was the beginning of an initial trip, an exploratory trip to Ethiopia in 2001 that led to a series of visits over the next 15 years to develop programs to train emergency medicine, family medicine, to reduce maternal mortality, to reduce female genital mutilation, to promote gender equity. So again, one thing led to another. Gurma came to my door. I said, let's give it a look. Mm-hmm. And before long, we were part of an international consortium working on capacity strengthening in Ethiopia and across Africa.
I think this is the theme I'm hearing for the both of you, is that there's certain people who this person would come to their door and they'd say, "Great question, I don't know." And instead, you're the both kind of people who would say, "Well, let's talk about it. Let's see what opportunities exist." People who believe that there are solutions and that you can be part of that solution. So it's so cool to hear how you all accept and welcome opportunities and challenges, rather than thinking, what can I possibly do to make a difference in that, such a big problem. So I really think that's fascinating. And I hope that listeners are taking that away, that there's that spirit of it's one step at a time, and you can take on really big problems and make a difference. Kirk, you've transitioned to domestic work and in public health. Can you tell us about your experiences?
Sure. I've always been kind of split between domestic and international. Like in college, I was very much part of the anti-globalization movement, in med school, fighting for the expansion in HIV treatment in lower income countries. But then during the pandemic, I moved back from Tanzania out here and was working with the Department of Health on COVID programs, and worked a lot with the Physicians for a National Health Program to expand a single payer national health insurance. So these are critical issues in the U.S. But really, a lot of my work in the U.S. has really been global health work. It was taking care of refugees, doing primary care for them and asylum seekers. The last 3 years, I've been the family doc for the Tonawanda Seneca indigenous nation, and quote unquote New York. But I think they very correctly depict the way that I'm coming in as a foreigner every day. I'm entering their country and providing care. And they've also invited me to work on public health issues. New York State had the nerve to really set up an industrial park right at the border of their nation. And they're very much fighting it. I'm very much a voice for the public health effects that are coming from this and we would expect in the future. Also, I'm very involved in the rights of nature movement. We're pushing to get the Great Lakes Bill of Rights passed that would protect the ecosystems of the Great Lakes from corporations and other quote unquote development.
And I have a follow-up question on that, but I just want to tag something I'm thinking about as you guys are talking is that, another quality of someone who's committed to this work is the willingness to be an outsider and to be the one who is not generally the center. And I think that that's something that as Americans, we're very used to being able to always be the insider and to impose our own beliefs or needs or expectations on the world. And so I think a good global health and public health person is someone who's willing to be the outsider and step into the unknown. You've alluded to this a little bit, Kirk, but I'd love to hear a little bit more on you describe yourself as a part-time physician and a part-time activist. What does that mean to you?
Yes, I think it's always been true, but coming back to the U.S. the last few years, I very much said, "Gosh, well, I want a part-time job, doing clinical care, and a part-time job doing, global health, public health work, and activism along with it." And I've very much been doing that. I've been doing clinical care 4 days a week, and then with my extra time, I've been, going to environmental hearings, writing op-eds, contacting government leaders and pushing them on these public health issues. Also, actually, a lot of my patients, I have half-hour visits with my patients, which are great. And a lot of times we get through their medical concerns and then we end up talking about, well, geez, what is the next step in fighting these companies in the industrial park? And so, I'm protesting with my patients, and we've become very good friends. I've joined their history and culture book club. So there's a lot of fronts that, I think a lot of times we have these thick boundaries between this is clinical care and this is everything else. It's all connected.
But you're empowering patients to have their own voice in their health and their environment and how that affects that. So,
yes, and they're empowering me by allowing me to do this in partnership with them. I feel honored.
That's so interesting, and I love that you're recruiting in the exam room.
Well, I'm hearing something from Kirk that I think is so important, and that is he's got this passion, this kind of fire to do what is needed to help the patients, the community, the area where he's serving. And I guess I'm curious, where do you think that fire or that passion comes from, Kirk?
Yeah, I guess I've always, been so drawn to social justice. It was just, seeing the injustice just really made me burn up. And I just, I grew up in a middle class family, and I had opportunities that a lot of folks haven't had, and it just was really clear to me all throughout my life that it wasn't fair. And the more that I work with underserved communities, and especially abroad where the disparities are even larger, it just really got my passions burning. Like, this is the fundamental thing that's wrong about the world that we need to all be working on in our own different ways, whether it be medicine or public health or whatever field you're involved in.
And it's so important too. It's so important for patients to understand the context of their health and understand, that there are things they can do, and maybe understand the impact that certain environmental and governmental situations have on their health. And so I really appreciate that you're engaging them in those discussions. Very exciting. And I think maybe just it invigorates people to come into the exam room with maybe a list of concerns and come out with a mission and a purpose. So that might be a pretty transformative moment. Cindy, as a mom, I've actually had discussions with you in the past about what it might be like to relocate children. So you are describing these fantastic adventures and these amazingly impactful things that you've done in your career. And I just want to remind the listener that you did this with not just yourself. You had quite a crew with you. So you served abroad and worked abroad several times with your family. Would you mind sharing with us what that was like and what challenges you faced?
Well, since I grew up partly in Pakistan and the US, I've reflected back that was so valuable for me to have that experience. And when I met my then soon-to-be husband, when we talked about it, he agreed that this would be something that he could support. He would go along with it. He wasn't necessarily as passionate as I was, but he was 100% supportive. And so having a supportive partner meant everything in the world. So basically, with our 4 children, we lived in Uganda, Pakistan, Geneva, and we had a number of other shorter term visits to places. But those experiences were quite profound. They weren't all easy. There was a lot of difficulty with diarrhea, malaria, jet lag, missing school, needing to homeschool. But in the end, I feel like our family benefited enormously. And our children grew up as a sense of a global citizenship. And as adults today, they're all involved in different types of social justice or making the world better, or have chosen their own partners from around the world. And so I do feel that we have created a global family. As we speak, my daughter is in South Africa. She's a pediatrician doing global health work. And this has become the focus of her career. So I couldn't be more proud of the children. They put up with a lot of shots and a lot of difficulties over the years, but they also had some really great adventures and lots of wonderful family bonding time, because going through difficulties together brings people together, right?
And it sounds like one of the takeaways from this is that if you know this is the path you want to follow, then you need to carefully and consciously engage in discussions with any potential future partners to make sure that they're on that same path or amenable to that same path, so that you're not pulling a U-turn on your partner and who envisioned a life in the town they grew up with in a comfortable life with all predictable things. So making sure you have that discussion.
And if I could just mention, follow up on Kirk's comment about global health at home, I do think that we have a lot of local needs within the U.S.
Yeah.
And we have a term called local health with global implications or influences, and caring for refugees, caring for immigrants, caring for people who are living in disadvantaged communities. I think that's a form of a global health commitment that can be done right in our own borders.
Yeah, great point. You are, I believe the appropriate term would be semi-retired. Is that correct? Or sound right? Semi-retired. And you are, how are you spending your time, and how do you see your retirement going?
Well, in addition to time with my grandchildren and family, I just love being in nature. And like Kirk, I have a deep concern about our climate, global warming, climate and health. So I've joined organizations that are focusing in on how can we activate health professionals to address climate and health. I'm able to volunteer and work in areas of great need, caring for the homeless, What I found is there's so many wonderful things to do that there's not enough hours in the day. We'll
Right.
never get done with them. But I'm really feeling very privileged that I have this phase of my life where I don't need to be in a hurry and I
Mm.
can really focus on those things that matter to me and also quality time with my family.
Yeah, that sounds like a lot of fun. um, Kirk, what is the biggest problem you've faced in global and public health? And do you have any ideas for improvement?
Oh, sure. I mean, I think the inequities all around the world are, I think, the biggest challenge, and that there are, so many different concerns. But I think the one that I've really focused most of my career on is, like first, let's do no harm. If we're going to contribute abroad with global health, good intentions and hard work are just not enough. I think there are very different ways to do it, like this, suitcase medicine, also coming in as an outsider and planning to build a health facility. It takes a lot of money and time and effort, but
Mhm.
but boy, it can hurt more than help them as well. So I think these traditional approaches, we need to pivot away from them and move over to these empowering approaches where local people are taking center stage. We talked a lot about training health workers, whether that be
Yeah.
clinically or in terms of public health work. I think, as long as, they're also training us and the power is flowing in both directions to equalize things, and they're picking the topics that we train them in, I think it's a great way to do it. Health system strengthening. There's so many different ways that if they'd like us to partner with them to help improve how efficiently
Mhm.
their system functions. And, also the community-based health programs, I mentioned how passionate about them I am. And,
Yeah.
it really, should be made from start to finish by local people, and us very much in a backseat role. And I think the last, empowering approach is, when it's done right, professional disaster relief, which is,
Mm.
mainly a public health approach, and it follows evidence-based standards, and we kind of just help them get through a rough patch as they want us to.
Right. So, do you have any additional thoughts?
So I think that one of the main issues is that there's this sense that if we just take care of our own, that's sufficient. And a lack of a recognition that we live in an interconnected world.
Mhm. Right.
And how we learned about this during the global COVID pandemic. A little virus on the other side of the world turned everything upside down.
Hmm.
And so we live in this interconnected world where taking care of our own is not really enough, because
Mhm.
this whole earth is our home and we're all connected together. And so that leads to issues of resource allocation. There's simply not enough physical or financial or human resources for health. We have a severe shortage of health professionals in the US and
Right.
worldwide. And so we need more young people to come into the health professions and find out what a wonderful difference you can make and how gratifying and rewarding that is.
Exactly. Do either of you, I can imagine that sometimes people who have an interest in this area feel a little isolated, or that they maybe don't have someone who can help guide them. Did either of you have a particular mentor that helped guide you or put you on the right path?
Do you want to start, Cindy?
Um, well, I had a whole network of mentors. First of all, I mean, I'll go back to my like grade school teachers who
Oh,
encouraged
great.
me, to keep on going. My high school math teacher, that I could handle calculus, and then kind of along the way, so many teachers and mentors and guides, and certainly in global health. I actually found a small handful of people. I wrote them letters. This was back in the day before the internet.
Yeah.
They wrote me back. They offered to talk to me on the phone. We visited, and they became really my guides, showing me the way of how to take a step by step approach to gain skills, gain experience, and
Mhm.
then pay it forward.
And I think typically it's a pretty generous community inherently. So, don't be afraid to ask for help. So, what about you, Kirk? Any mentors?
Oh, sure. So in college, Ted Brown was really the public health social justice guru, and he's continued to be a major mentor for me. and that global health residency program in Rochester. Steve Schultz started it up, and also Doug Stockman created this really great partnership with Honduras. Also Jeff Harp did the same with Haitians, and so I think all three are really important mentors. But I think most of my mentors in global health have been folks in resource-limited countries that they're too numerous to name. I'm sure you probably say the same, Cindy. But it's just those are where my main lessons came from.
So there is some place where you can read a little bit more about this. Kirk, you have written a book on this topic. Do you want to share with us a little bit about that and where we might find it if we want to read more?
Oh, sure. So if you go to Hesperian.org, you can get Doing Global Health Work. So this very much came out of journaling from my early experiences. I was living in Puerto Rico, and I said, gosh, what worked well and what didn't work so well, and how can we do better? And I scoured the literature. I became obsessed with the idea of, how can we, help the most we can in a more sustainable way without causing harm to communities. There's a lot of information out there. So I wrote, a million stories from all of my adventures abroad and cited a whole lot of evidence. And like I mentioned, I really split things off into this traditional approaches and empowering approaches and encourage folks to pivot to the empowering ones. But I also get into 3 layers of agendas. Us asking ourselves, what's really driving us and what are we really trying to work on? The first layer is the type of work we do: clinical, public health, social justice. Communities should be deciding, not us. The next layer is what are kind of funding and goals our organization has. Are we trying to convert people to a certain a religion, or expand the market base of a corporation because they're giving us free supplies to use, or following what our government wants us to really work on, or what the donor wants us to work on? Instead, we should be, of course, listening to the community. And then I think the last layer of agendas are just what we do on a daily basis, and are we focused on our own needs? Like we want to be tourists going around, or we want to train our own students out there. That's important, but I would argue what's even more important, is the capacity building of local people and health system strengthening. These is agendas that are driving us. So I very much wanted this to be helpful for students and early professionals that were asking the same questions that I was asking early on. And they can, I think, use this framework to analyze global health organizations and to try to tease out, well, geez, what are their core agendas and what are the main approaches that they follow? You can get this from their websites, from global health conferences, from conversations. And, are they truly following the community abroad rather than leading, imposing their own agenda? So I hope folks will take a look at that. Thanks.
Yeah, and I found it by searching your name on Amazon as well. So it's pretty easy to find, and we'll put that information in the show notes. So you'll have the name of the book to look for it. So we hope people will give that a read. So a few rapid fire closing questions for you guys. We'll have you each answer and one at a time. What is one piece of advice you would give to an early career physician? Let's start with Cindy.
So I will say, hold on to your purpose. What is that fire, that inner fire that keeps you going, that gets you up in the morning? And if you can identify that and you can keep kindling that, make sure you don't lose touch with your purpose. And if it's caring for patients or developing public health programs or communities, but stay true to your purpose. Also, stay connected with your loved ones. It's relationships that sustain us. And so you need to stay connected with those people that you love, who love you back, in order to have the strength to do this over the long term.
Sure.
And then finally, you got to take care of yourself. You are your own best tool. And if you're not taking care of yourself, you're not going to have the stamina to be able to hang in there for the long term, because this is a marathon. It's not something that's solved in a short period of time. And so you've got to make sure that you're taking good care of yourself, resting and rejuvenating so that you can go back in for the next round.
All right. Thank you for that wisdom. What about you, Kirk? What are you passing on to the next generation?
That is such great advice. I wish I met you, Cindy, but way back when I was a student. The inner fire. I think that's a great way to put it. And a similar thought that I have. I use the term social calling in medicine. Everyone's worried about what specialty they're going to go into, and it's a big decision. But also the social calling, like how am I going to serve underserved, and who do I connect with? We really resonate with each other, whether it be a group or a culture, or more than one. And I think folks can really find a connection that way to their purpose moving forward. And I think also, giving up on charity. When I was in college, I was, directing this community service program in a community service dorm, and I was doing things for people, and it feels good, but we have to shift over to empowering folks. So there's less interest in charity, less need for charity. It can hurt more than help. So I think those are key.
That's great. And I think it's important. This is why we're doing this podcast, is that what is that inner fire? What's that things that is going to sustain you throughout your medical career? And how are you making room for it now, early in your career, so that it's always there and that there's always that room for it, rather than saying, once I pay off my loans, I'll have time for that. Or, once I get my basics out of the way, I'll have time for that. That there's never a great time for things, and it's always a good enough time, right? What is one piece of advice, Kirk, that you would have given to your younger self if you could go back in time?
I think to hold back on the drive of a bleeding heart. As an activist, you want to just do, and a lot of passion students, get involved in global health that way. And I don't want them to hold back, on the passion, but if we can, spend a lot of time listening, like we talked about, and go ahead and get the training, that will make you even more helpful as a partner to folks.
And Cindy, what would you tell your younger self?
Well, I'll tell you what my husband used to tell me, and that was, Cindy, there's a finite number of things you can do and an infinite number of things you could do. So you have to pick carefully, right?
I'm not good at that either.
Choose carefully. But I would also say, maintain this sense of awe and wonder. It's so amazing what we are able to do as physicians, just the wonders of the human body, of nature, and make sure that you're enjoying taking time to smell the roses, take a walk, find some time every day to just soak in the wonder around you, so that you're not depleted and exhausted and you have nothing to give.
And I just want to say that Cindy is not making this stuff up, and she's not spouting cliches, because I've worked at her side in Milwaukee and seen her, after a long morning of precepting family medicine residents, get on her coat in the blazing cold in the winter, freezing cold, and take a walk and find some kind of beauty in the middle of downtown Milwaukee. So if she can do it, so can you. So she's speaking the truth here. Okay, Cindy, what are you loving right now about medicine?
Well, I think medicine is a phenomenal field, and I just feel like I'm one of the luckiest people in the world that's had one of the best jobs in the world. Knowledge is accelerating, and AI is coming up, and hopefully AI is going to make it easier on doctors to not try to be typing while they're seeing patients. So I'm looking forward to that.
Yeah.
But even with all of our technology, with all of our computers and AI, there's nothing that will replace the human touch, the trust in someone who cares about you, the importance of conveying that. And so I think physicians will never be replaced by computers, because computers don't really care, right? And so our care for the patient and genuine concern for them is something that's absolutely irreplaceable. And what happens is, when you extend that to patients, it comes back to you in spades. And so I have felt so supported and buoyed by my patients, my colleagues, and just the endless opportunities to care, but also to learn and to grow.
Great. And what about you, Kirk? We love
It's
it
really
about
well
medicine.
put again. Yeah, so just enjoy family medicine so much, especially the preventive aspects and public health and the global health applications there. And I think, also just working with Indigenous people as partners, I think there's a completely different worldview that I have learned so much from, and I've been inspired by the traditional Indigenous worldview all throughout my career, but now more than ever. And with the climate crisis that you alluded to a couple times, I think that we really need to be listening to and following that worldview and their historical experience and living in harmony.
Great. And Kirk, what's next for you?
So on that same theme, continuing to do talks on my book and the themes, but I'm working on a new one with an Indigenous elder who's a good friend of mine. And we're looking at the intersection of the climate crisis, the biodiversity crisis, and the inequality crisis, and the oversized role that the U.S. has had in all this. And therefore, the oversized role that we could have in terms of taking responsibility, making huge political and economic changes, listening to that wisdom of Indigenous folks to really go ahead and do this. I think folks that are following One Health and planetary health, this is the next realm for global health, Cindy. I think you're right on top of it as always. We can't look only at our own health or that of animals or that of the earth herself. It's all connected, and we have to acknowledge that if any of these three is going to improve their conditions here.
And so what about you, Cindy? What's next?
Well, I'm looking forward to spending more time with my grandchildren, 5 of them now. And so we have all types of adventures. I'm in training to be a tide pool docent to help people understand the wonders of the tide pools along the Pacific coast, close to where I live. And really opportunities to serve, to continue to volunteer, to work on Catalina Island, another really beautiful place with a shortage of health professionals and a nature preserve, and to just stay in a state of wonder about this precious life that we've been given and the opportunity we have to have conversations like this and connect with others.
Well, Cindy, you make it sound pretty amazing. The retirement sounds pretty good. So I thank you both for joining me today. I think that the listeners will really enjoy hearing from your experiences in different phases of your career. Cindy, if someone wants to find you or learn more about you, do you have any suggestions of where they should look?
Well, you can Google me, but I am happy to share my email in the end of the credits. So
and you're also on LinkedIn as well. Is that correct?
Yes, that's right. Yes.
And so you can message her on LinkedIn. And Kirk, where is a good place to learn more about you and your work and your book?
Oh, sure. If you go to Hesperian.org, or you mentioned Amazon as well, it's available. You can get information on the book, Doing Global Health Work. You can type in. I'll also share my email because I'm a social media ghost, so I can't connect with you that way.
Okay, good to know. Well, thanks so much for joining us for this chat on global health and public health. We hope this show has you thinking about your own career and what actions you can take to make it ideal for you right from the start. If you've enjoyed this episode, please like and subscribe and tell others to join us. We greatly appreciate your reviews and comments, which help us grow to a wider audience. If you want to stay in touch, you can email me at practiceonpurpose@heyinfluent.com. Let me know what topics you want to explore in future episodes. And remember, build your practice on purpose to stay connected to your purpose. I appreciate you joining us on this journey, and let's keep exploring together. Until next episode.